Hello, everyone, and welcome back to Midnight Momentum class number 6. How did we get here so fast already? So today we are going to go over implementing reinforcer assessments. Please keep in mind that there might be some details missing. We do want to keep these short and straight to the point. So let's start here. Before we conduct an assessment, here are some questions that we should be asking ourselves. So, do I have the right to assess and intervene? And is it within your scope of competence? So if you do not know how to conduct this type of assessment, you do not learn by just doing it. You should be trained. You should be provided some sort of task analysis on how to do this. You are to be guided if you've never done this in your life. So number 2, what client records do you have access to? So although we do have to make everything individual and updated, it is good to know what has happened in the past, if they have any medical concerns or anything that we might look at it and be like, okay, this type of behavior is just happening out of nowhere. It's never happened in the past, and it's quite concerning. Like if the child starts to eat their sofa out of nowhere, okay, that is concerning, and we want to definitely reach out to a doctor. So next is intervention of this target behavior necessary right now. So in other words, is it socially valid? Is there something else occurring that is more important and we should be focusing on that behavior versus the one in question right now? And always remember reactivity. So this is when client's behavior changes due to the presence of the assessor. So this is when we might have met a client and the parent starts telling us all these stories, but when it's finally our time to work with them, the client's so excited, they're behaving great. Okay, that is totally normal. Or maybe they don't behave great. So just keep that in mind. It is temporary, this reactivity being observed. So as far as reinforcer assessment, when do we conduct it? So after conducting an FBA, which is functional behavior assessment, and outlined function-based interventions. So here we are presenting one or more stimuli contingent on target response, and then we move forward to measuring the effects on the rate of responding. So we are interested in the relative effects of a given stimulus as reinforcement under different and changing conditions. So we are putting a lot to the test here because we want to know what's going to work best with our clients. So what do we need to see? An increase in future responsive behavior. So it's important to understand that this is a direct database method. I put down here 2 AKAs. It's reinforcer assessments are also known as experimental analysis of reinforcer effectiveness. That's like a sentence long, but try remembering that. And then reinforcer analysis. Now, these are the 4 different type of reinforcer assessments. We have concurrent schedule reinforcer assessment, multiple schedules reinforcer assessment, progressive ratio schedule reinforcer assessments, and in the moment reinforcer analysis. We are going to start with concurrent schedule reinforcer assessment. So when you see this, think matching law, aka also known as matching theory. And like we said yesterday, behavior goals were intervention flows. So we are putting 2 stimuli against each other to see which produces a larger increase of responding. So here I put a little example. And we are presenting choices where a participant is asked to complete 30 math problems for 15 minutes of watching TV. So think of an FR schedule. Or listen to a video on YouTube about the math lesson for 45 minutes, and in return, you get 35 minutes of watching TV. FI schedule is being placed there. So whichever one they choose from these 2 available is going to be the one that's more reinforcing to them. So Keep in mind that assessing if a low preference item becomes higher preference when participant is not given the choice of their high preference item activity. So don't always just give them the choice of doing something you know that they will pick. The purpose of this is to find out if we can use any of their low preference stuff compared to one of their high. That's why behavior goes where reinforcement flows. So here are some pros and cons. So the participant is given choices and they can make choices. We are directly involving them in the assessment, and that is important for us. Participant having choices to pick from mimics the most natural schedule of reinforcement. So in our day-to-day life, we encounter these type of schedules, and we're the ones that have to pick which is the most reinforcement for us. So participants are required to choose between stimuli rather than indicating a preference for a given stimulus, because we already did that with preference assessments. And a con is the presence of a very high preference item can conceal the relative preference of lower preference items. In other words, like I said earlier, try not to give choices of things that you know they're going to pick, because then they're just constantly going to pick that one that we already knew, and that's not the point of this. So what are we going to be looking for? 2 or more contingencies of reinforcement. They operate independently and simultaneously with 2 or more behaviors, and each schedule is correlated with an SD. Next, we have, so this is not in the way anymore, multiple schedules of reinforcer assessment. So here we're looking for 2 or more component schedules of reinforcement for a single response with only one component schedule in effect at a time. So here we don't have a choice. It's just one or the other. We don't choose between the 2 options available. So one class of behavior, SD being present to imply which schedule is in place. So the SD being present is just the hint to the client of what can happen and when to use. Comparing the reinforcer effectiveness of response-dependent contingencies versus response-independent contingency, and being able to implement both in the correct environment. In other words, when we are comparing these 2 types of things, we can say, okay, you have to let this amount of time pass by without the behavior occurring, or with the behavior occurring within that time, and then you can receive reinforcement. Or we do a response independent contingency where we just want the time to pass by, and then we can choose which one we can implement in the correct environment with our client. Next, we have progressive ratio reinforcer assessments. So this is systematically thinning each successive reinforcement opportunity within the session independent of participants' behavior. So think breaking point, when the participant stops responding. So being exposed to long periods of any breaking point is also known to be aversive. You're pushing the limit and you keep offering the same amount of reinforcement for more work, they might just behave worse. So this type of reinforcer assessment is time consuming when trying to develop a scale of the effectiveness of specific reinforcers. Why? Because we're moving little by little until we finally reach the point that they stop responding. So here we can start with an FR5 schedule and begin to increase the ratio until breaking point is reached. So in other words, moving from an FR5 to an FR10. Yes, very similar, actually exactly what thinning the schedule is going to be. That's what we call breaking point. So what do we care about here? Response output as opposed to response rate. And breakpoint values are the primarily measure of interest when evaluating behavior with this type of reinforcer assessments. We want to know what is their highest amount of response for the least amount of reinforcer. And last, we have in the moment reinforcer analysis. So when the practitioner makes a choice of presenting a reinforcer in the moment. So here, think of it like this. We're just winging it. And we might find ourselves doing this often. So how is the reinforcer chosen in the moment? These are some things we have to pay attention to. Take a look at your client's facial expressions. Are they laughing? Are they angry, smiling? Have noted previous reactions to certain reinforcers. So did they approach it? Did they make eye contact with this reinforcement? Is there data showing that this said reinforcer has increased or decreased target behavior? These are all things we need to keep in mind. And then learner's response is followed immediately by the presentation of the assumed reinforcer, and effect of the presentation is noticed for future interventions. So if we were just in the moment and we got to pick something quick, it worked, we note it, and we keep going on. If it didn't work, we should also note that. So keep in mind, stimulus preference assessments assesses potential reinforcers versus reinforcer assessments. We are focusing on assessing the level of reinforcement for the client. These are often done together to test the results of preference assessment and if it actually works as a reinforcer. So in other words, here we're just creating a list of things that we're going to put to the test. And how are we going to test it? Right here. So that's all for today. Let's connect, follow us on Instagram. Here's our page, and I will see you guys tomorrow.